Ring of Fire. I'm Mike Papantonio. Over the last few years, talk about health care has been dominated by discussions over insurance coverage. But there's one health care topic that's remained undiscussed, but just as important, and that is price gouging. I have attorney and consumer advocate Ben Gordon to discuss that topic. Ben, the hospital industry, the healthcare industry is eating up 20% of our GDP, a staggering number when you compare that to the rest of the world. There are no comparisons. If you take urbanized cultures all over the world, urbanized governments that really aren't much different than ours.
Yeah, and if you look at it since the 60s, it's staggering. It's gone up from 5% to 20%, and some projections, including by the Social Security Administration, are that by the year 2080, it could eat up 70% of our national income, of our average national income. I mean, it's unprecedented. It is a crippled industry, and it is killing the American workers. It's killing our country.
Well, they've been studying it ad nauseum now. I mean, if you take a look at what McKinsey and Company, of course, we see their studies coming out regularly. They've devoted decades to trying to understand what's happening here. And one thing they identify is happening is you have the hospital industry spending almost $6 billion a year lobbying. Now, let me put that in perspective. The numbers, it even dwarfs the defense industry. It dwarfs the oil and gas industry only spends $1.3 billion. What is it that's at stake? Why would this industry be willing to say, you know, we're going to put up $6 billion to protect our profits?
You know, once again, Pap, I think it's just about corporate greed. You know, they want the American public, the American worker, the average man to feel that they have to have better and better increasing technology that is often is not proven because we have a broken FDA, a broken government system that doesn't allow these devices to get the scrutiny they need. So, for example, with a company like Stryker, a company like Johnson & Johnson, these medical device companies go to the hospitals, go to the doctors, they work hand in glove with them, and they say, hey, doctor, if you will choose this hip implant for $10,000 that cost us $600 to produce, then we'll make sure that we take care of you on the back end. So it's a system that is promoting profit for everyone in the chain except for the guy at the end who has to spend, you know, 20, 30, 40% of his yearly income to believe that he's getting good health care.
Yeah, and so one thing we're seeing, you hit on a really good point, and that is the new industry within the industry, and that new industry is making things that we can sell at a 2,000% markup, 1,000% markup. It's not unusual, as we've talked about on this program, to see a pill marked up 2,000%. But what we're also seeing is new technology. I mean, CT scans, for example. It used to be that in the entire United States, I think maybe there were 3,000 CT scans available that could be used. Now there's 10,000, and the numbers are staggering of people that are being pushed through that system because the profit margin is so high.
That's a great example.
A hospital, a CT scan is paid for in about a year. In other words, you buy the CT scan, hospital pays for it because they spend so much money charging.
And it's pure profit after that. And it's throughout the industry, the pharmaceutical companies and the device companies are controlling the decisions, and so that the doctors and the hospitals are in bed with them all make a profit. And another part of the industry that's crippling the entire system for American workers is the insurance industry, the Blue Cross Blue Shields of the world, that are dictating to the doctors that they will use a particular company, and that those companies then control the marketplace and drive premiums higher and higher for consumers. The amount that we have to pay for health care and health care insurance in this country is increasing just exponentially every year.
Well, at some point it becomes such a problem that you wonder even whether it's reversible, because they build their own infrastructure, don't they? Right now you have the industry out that is, you know, they're in front of Congress, as I said, spending $6 billion lobbying. But what are they lobbying for? They're lobbying so they can allow Medicaid doctors to mark up an exorbitant amount of money for Medicaid patients. That doesn't mean the Medicaid doctor gets the money. It means the hospital gets the money, or some part of that industry gets the money. So every day they're lobbying, saying we want taxpayers to foot more of the bill. We want taxpayers to pay more money, and it should be just the reverse. We should have a Congress that says, no, we're going to draw the line in the sand. You're not going to be able to show up here every year and say you want more for a CT scan, or you want to be able to charge more for a wheelchair or a cane. But that's what goes on, and taxpayers end up footing that bill. For a cane that should cost $10, they end up saying, well, this is a $60 cane.
That's right, and we've got things a little bit backwards in this country where the pharmaceutical companies and the device companies are dictating what the patients need. The pharma companies, the device companies, let me give you an example. In 1999, there were fewer than 100,000 people a year in this country that got a hip implant. By 2010, a scant 10, 11 years later, there are almost 500,000 people per year that need, supposedly, a hip implant. Now think about that. Right now, 500,000 people a year plus are getting a hip implant because the pharmaceutical industry, the implant device companies say they need one. Well, guess what? It's because they are making, Johnson & Johnson, they're making record profits on these devices that don't even go through FDA scrutiny. That we're trying to get that changed, but up until recently, there is no FDA. They simply file a letter, and in 90 days, they can put this device on the market and put it in 500,000 Americans a year. And they send these doctors on trips. They sponsor the doctor's research. They go to the doctors and say, doctor, use our hip implant, and put it in younger and younger people. So we got 30-year-olds getting hip implants in this country because the pharmaceutical and the device companies are dictating what the patients need.
Well, one thing we forget, we hear a business, we'll hear, well, this is a nonprofit charity hospital. That's the new thing, to call themselves nonprofit charity hospitals. Nothing is further from the truth. In these so-called nonprofit charity hospitals, you have rank and file upper management making $500,000 a year. People at the top are making $1 million a year, and they say, well, we're a nonprofit. Well, not really. What they do is at the end of the year, if they have in cash, an extra $100 million, they'll simply take that $100 million and build another wing onto the hospital, build another facility that they call a research facility. It's not a nonprofit entity when you have the people at the top that are making $1 million and $2 million a year in this thing that they call a charity hospital.
And wanting everybody to believe that they're a charitable organization when they're making huge profits, and the consumers, the patients out there, are the ones that can't afford the health care and can't afford the insurance premiums that keep going up, while these people are all getting rich and saying that they're doing it for charity.
Well, if you go to most small towns and you have that thing called the nonprofit hospital, first of all, you have an entire town that believes, first of all, that it's a charitable nonprofit hospital. And then second of all, what ends up happening is the entire town is built around that hospital. Look, it's become such a huge industry now that if you go to New York, for example, you would think, let's take a town and use it as an example. You go to New York, the hospital industry is an employer ahead of Wall Street, ahead of the banks. The hospital industry has such a reach, even in a city like New York, that if you can imagine, how does that translate when you go to small town, like Topeka or some middle America? It becomes the center of that town, and because of that, they wield such huge political influence that they get done what they want to have done, don't they?
It makes for great sound bites. It makes them sound like they're a great corporate citizen, like the Johnson & Johnsons of the world, wanting everyone to believe that they're doing, making great advances in medical technology, when reality is they're selling devices that don't have any proven efficacy, and they're marking them up thousands of a percentage point, as you said, and the consumers can't afford it.
Well, to put this in, I saw some numbers here. To put this in perspective, if you took a look at the $60 billion price tag, a $60 billion price tag for the Sandy hurricane cleanup, that is what was spent almost just last week in health care. Now, I guess where this is headed is, do you see any way to reverse this? Are they so entrenched at this point, both in Congress all the way down to the locality, all the way down to the small town where they are the big industry. Aren't they so entrenched that it's very unlikely that this is reversible?
Well, it's going to be difficult. I mean, it's going to require some major backbone by politicians. The Affordable Care Act has some provisions that many experts believe can work if they're allowed to work by Congress, and that we can try to get some things under control. But unless the pharmaceutical companies are reined in and required to prove efficacy and safety of their devices, take this example, Pap. These companies get $10,000 apiece for hundreds of thousands of hip implants, for example, and guess what? The FDA doesn't require long-term clinical safety, so the device turns out to be a piece of garbage. It hurts people, it kills some people, it has to be ripped out, the patient has to pay for that, and then they have to have another one put back in. So guess what? The company makes another $10,000. They're laughing all the way to the bank. They have no incentive to knock down their costs. The patients keep buying more because they're told they have to. And then what do? We have to get those companies under control. Unless we get the industry companies under control, then we're never going to be able to save money for consumers.
Well, isn't part of the problem, let's just use that example. Let's put that in, say, the Medicaid or the Medicare analysis, okay? In the United States, if you compare the United States, what we pay for Medicaid treatment such as that, and you compare what Congress has said taxpayers have to do to foot part of that, part of the bill, you compare that to almost anywhere in Europe, it's four times as high that transaction is going to cost, because the people at the top simply determine how much, what the bill is. Yeah. Germany, for example, if you just take a CT, we were talking about CT just a minute ago, if you just took a CT analysis, in Germany, when you compare what they charge for CT to what taxpayers pay in the Medicare program for somebody to get a CT scan over here, it is 4 times as high. So I don't know that there's any solution, any quick solution, when you have an industry that's paying $6 billion a year to lobby Congress. And again, compare that to even the oil and gas industry, where they're only spending $1.3 billion. Is there an easy way out of this?
I don't see an easy way out, particularly as you point out, when great countries that have very good health care, charge a fraction per capita for the same kind of care. We have a system here that's broken, and it's going to be many studies and experts are saying now it is the single greatest threat to the security of our country as a whole facing us in this century.
Well, and Ben, when you really step back and look at this whole, all these issues around Obamacare, and you say, is this going to actually change this problem? In fact, in many ways, it makes it worse, doesn't it?
There's no question
the
about it.
healthcare reform is stretching to call it really reform in terms of what it does from a financial standpoint, doesn't it?
There's no question. It's a grave crisis in this country. The American people are paying for it. They're going to continue to, unless our country, leaders and especially the FDA and Congress develop a backbone and hold people accountable for these escalating costs.
Too much money flowing to Congress from the industry right now. Ben Gordon, thank you for joining me.
Thanks, Pat.
When we come back, we'll take a look at how the Tea Party has helped make this one